This week was one of those weeks that I really wish I didn't work in healthcare. It's so frustrating to work in short-term rehab and watch insurance companies cut people from any more services after a week or 2 weeks, send them home, and we know that they're either going to return or worse, that they never will get the chance to return to us. So in today's video, I want to give you 2 pieces of advice. If you have a loved one who is in a short-term rehab facility and the insurance company is cutting them, and you feel like they're really not safe to go home. But before we get into the video, I'm Tammy Provenzel. I'm a physical therapist and a life coach for caregivers. Our healthcare system is so broken right now. There aren't enough resources or guidance for caregivers. So I started this channel to be a resource for caregivers, especially of an aging parent. So if your loved one is in short-term rehab and the insurance company has decided that they're going to cut them and it's time for them to go home, I'm going to offer a couple pieces of advice. But I want to make it really clear that the things that I'm recommending are not for people who come into a facility and it's then determined in the facility that there's a level of dementia that the facility then recommends 24-hour care. That's different because there isn't the expectation of improvement. The person who's going to need 24-hour care is always going to need 24-hour care. In this case, I'm talking about where somebody's either medically unstable to go home or there's something going on that needs to be figured out first. I had a couple of recent patients that this happened to. So in the case of these 2 people, there's definitely something medical going on. And trying to get into a doctor, to like a neurologist or a specialist of any kind right now, takes months and months, but insurance doesn't seem to care. The couple of things that I'm going to recommend are, first, when your loved one or you get the notice of non-coverage, the facility has 2 or 3 days, I forget exactly which, to give the patient the notice of non-coverage, meaning insurance is cutting. As soon as you get that notice, file an appeal. That will give you a couple of days more of remaining in the facility, a couple more days of therapy, a couple more days of medical oversight while you're waiting for them to decide about the appeal. Once you get the decision, if they don't uphold the appeal, appeal again. And I believe that there's up to 3 times that you can appeal. And I would do that. Use every option you can. The second thing that I recommend is contacting the insurance company. Most of the time on your insurance card, they'll have a number that you can call. Call that number and tell them all of your concerns, that this person isn't safe, that they're a very high fall risk, anything you can think. If there's medical issues, list those and make it clear that you're telling the insurance company that this is an unsafe discharge. I've seen that work in the past, so I think it's at least worth doing. And even if it doesn't work, I think all of us need to make it really difficult for the insurance companies. I think that we need to be a pain to the insurance companies. So even if they have to work harder because we keep filing appeals or we call them and we question them, I think that that's a way that we can at least take some control. And maybe eventually, if enough of us do it, that there'll actually be some change. Thanks for watching today's video. Please like and share, subscribe to this channel. In the comment section below, let me know if you found any ways to get insurance to cover more. Thanks.